My name is Emmanuel Ainebyoona, the Senior Public Relations Officer at the Ministry of Health, Uganda. Even before the COVID-19 pandemic, social media has been emerging as a channel that propels unverified information. And this included fake health information and individuals who want to propagate misinformation. When COVID-19 broke out in China and later spread across the world, social media has become a catalyst in propagating fake news and misinformation. And to some extent, the World Health Organization also termed it as an infodemic coming with the pandemic. So ministries and governments have had to spend more money in countering fake information because this has been affecting the preventive endeavors by the various entities that are promoting preventive measures against the pandemic. What has stood out most in this period of a pandemic is that the efforts to communicate the risk to the population has been affected, because there have been denial of some what had been referred to as COVIDiots, and the people who were saying COVID, the pandemic, is non-existent. That alone took some time for people to believe that there was COVID, because there was a group of people who were on social media, Twitter, Facebook, Instagram, YouTube, propagating denialist information on the existence of the pandemic. That is one. The other is now things like availability of the vaccine. People saying someone has discovered a vaccine or telling people a certain drug works on COVID, yet we know that there is no preventive therapy. Then also on the vaccines, some anti-vaxxers are using social media to create vaccine hesitancy, and this has affected uptake of the vaccine across the world, but also to be specific for Uganda, because with the access and penetration to mobile phone and smartphone penetration, many people are able to access social media, and they consume more information on these social media platforms. And to some extent, validating this information has been a challenge, thus affecting the response to the COVID-19 pandemic. At the ministry, we embraced social media way before the pandemic, to an extent that the ministry has social media accounts on Facebook, on Instagram, on Twitter, and also in a YouTube channel. So we have always provided information on the happenings, the programs, the activities of the ministry through social media. Even at the height of the outbreak of the COVID-19 pandemic, like daily updates, tests done in laboratories, new infections were first communicated on social media, because it was the fastest way to keep the public informed, because it is instantaneous. The updates come from the laboratory, they are processed by the comms team at the Ministry of Health. One of the first channels to transmit this information is the social media handles. So it has helped us in form of disseminating timely information. And we have had to use the same timeliness to counter fake information. If a fake post is circulating on an individual's account, we quickly identify it through our various groups, and we fact check it. If it is fake news or false or misleading information, we immediately provide the factual information on our social media pages. And there have also been innovations of fact checkers, so we keep fact checking the information that goes through. As you are aware, they are now even to an extent that people manipulate images, videos to develop manipulated posters and also create deep fakes. I don't know whether you saw a deep fake after the immunization of the minister. Some people created a deep fake to try to mislead the public that indeed if you took this vaccine, you would act like someone who is high or drunk on something. But that was a deep fake that had been manufactured by someone. But mind you, some people were inquiring whether indeed this had happened to the minister, which was totally false. So that shows how far social media, much as it is a breakthrough in terms of timeliness and reaching a greater audience, it can at the same time be harmful once not utilized well. The conference on social media during the period of the pandemic is a big deal because it gives us a platform to share experiences from across the globe on how we can utilize this new technology and new space to make our lives better. So I appeal to everyone to be part of this conference on social media because it will really help us to discuss issues like how do we regulate, for instance, social media, what technologies can be developed to counter fake information propagated on social media, what innovations like fact-checking applications, the WhatsApp bots that can be used to provide and collect information using social media. But also it is an avenue to see how best unemployed youth can utilize the much time they have on social media to make money and make their livelihoods better, irrespective of waiting and using social media for non-productive activities.